Yeah, my name's Dr. Gavin Jones and I'm a psychologist from England. Yeah, I'm a trained health psychologist and I'm registered with the Health and Care Professional Council in England. And I started my career doing an undergraduate psychology degree and developed an interest in health psychology, which focuses more upon the relationship between physical health and mental health. And after doing my undergraduate, I then went on to do my master's in health psychology, which became the first year of my training. And then I spent 4 years doing a doctorate in health psychology and specializing in psychological trauma. So during my training, I spent a lot of time working in the forensic services as the criminal justice system in the UK. I spent time working in a mental health hospital that specialized in treating people from prisons who had mental health difficulties and difficulty with substances, which we call a dual diagnosis. And I trained my working career in this environment. And that then led me to work in a detox unit that specifically supported people from quite impoverished backgrounds to help them become abstinent from drugs or alcohol. And it was during this time in a detox centre that I started to become very aware of the amount of psychological trauma that affects people with dependency issues. And I wanted to then further understand about the relationship between mental health and dependency. And I devoted my 50,000 word dissertation to examining psychological trauma within people in the criminal justice system and their relationships to drug and alcohol and other unhelpful behaviours that occur when people have mental health and dependency issues. I initially specialised in working with females which have psychological trauma, and as a consequence of doing the research and liaisons with other peoples in the area, started to develop a protocol that is a brief psychological therapy to support people come out of the psychological states they're in, that in doing so reduces impulsivity, which is directly related to dependency. So I spent around about I started going into psychology at the age of 26, and at the moment I'm 41. So I've been in the field a while now, within psychology and mental health. And the learning opportunities I've had over the years have really enabled a trauma-focused and dual diagnosis approach to working with people with dependency issues. As a psychologist, we're trained in the assessment, evaluation and intervention of people with a variety of psychological difficulties. But when you first meet somebody, they're not always aware of the difficulties that they're going through. So as a psychologist, we provide a continual assessment, evaluation and a provision of information that supports people to understand themselves. So core feature of a psychologist is the assessment phase, the core assessments are probably between the first 3 or 4 sessions, and it's a process of information gathering. And as a consequence of the information gathering, you're allowing the person to understand how their past, the experience in life that they've had, including things like biological factors, genetic factors, early socialization, the relationship with parents, friends, school, critical instances in life where distressing things have happened, but also positive things that have happened as well. How all these events and effects come together and give rise to the person who entered treatment. It's fundamental as psychologists that we begin by allowing a person to understand themselves. Because if they don't understand themselves, then they won't know why they are the person who they are. And it's about providing the person a formula. If they can understand the formula that has led them to experience psychological difficulties, issues with dependency, they can then start to develop with the psychological support how to change that formula to change their lives in the future. It's only by understanding the person who you were before treatment can you start to understand how you can make changes to be that person who you want to be in the future. And a part of the process for that is given a variety of psychological therapies. So as a psychologist, we're trained in many different approaches. And at the core of that is a formulation. And a formulation means you gather information and then work collaboratively with the client that you're working with. This treatment is together. It's not a process of informing them the correct course of action. It's about coming together and seeing how we can help each other to get the outcome that we both want, which is fundamentally based upon hope and change. And often within the psychology sessions, they're based upon something called cognitive and behavioral therapy, which examines cognitions, which are the things that go on in the mind. It can be mental images, it can be thought processes, it can even be dream content. And then looking at the behaviors that are associated to that. And by allowing the person to understand their thoughts, you provide them a provision to begin to change their thinking, because your thoughts relate to how you feel and how you experience the world. And by allowing the person to understand their unhelpful behaviors, you start to provide them an opportunity to realize that by changing a behavior, it provides the ability to disconfirm unhelpful beliefs that might be perpetuating the difficulties that they're going through. And it could be quite overt behaviors, such as the unhelpfulness of dependency issues. And dependency can be an over-reliance upon alcohol or drugs. It could be an over-reliance upon people in their lives. It could be a dependency of wanting to stay in your home because you're too frightened to leave it. We allow people to understand these significant dependencies, and we provide them graded exposure to change this, which changes the outcome. It gives people support and hope. It changes how they feel. It changes their mental health. But it's not just the big behaviors that we're aware of when we work with people psychologically. We're aware of the small behaviors as well. Behaviors that people won't be aware that have a factor into their well-being. And a common one that people are aware of is maybe nail biting. When they're nervous, they bite nails. So we'll encourage people to stop biting nails, because every time you do a behavior that indicates you're anxious or nervous or distressed, it communicates to the brain that you are distressed. So the behavior maintains the condition. So as equally as important it is to challenge the unhelpful thinking styles that people have that are keeping them in this psychological difficulty and stress, it's just as important to identify the unhelpful behaviors. And particularly within this, a core feature to most mental health difficulties and to dependency difficulties are difficulties around sleep. Most commonly, there's a difficulty to get to sleep, to stay asleep, or waking up too early, or not feeling refreshed and revitalized in the morning after the sleep. Or people use sleep as a coping mechanism because they want to avoid the world and they want to do nothing but sleep. But either way, the evidence indicates that when somebody sleeps too much or insufficiently and not correctly, this further exacerbates or even might be the first symptom of a mental health difficulty. And the importance for every person which comes into treatment is ensuring that they get the restorative and correct sleep that they need, because that supports the brain in enabling them to start to make changes. People which have poor sleep are more likely to have more negatively toned thoughts. And negatively toned thoughts are associated to psychological difficulties. And psychological difficulties, difficulties with sleep, and the other symptoms of trauma like anxiety and depression are indicators for impulsivity. By allowing people to change how they think, by allowing people to change how they behave, by giving people an opportunity to get corrective and restorative sleep, you can begin change right here, right now. Many people in their lives have experienced sleep difficulties who don't have dependency issues, who don't have difficulties in mental health. And you know what it feels like if you have a day or 2 days when you don't sleep. Imagine that tenfold and the effect it can have on people. So the treatment of psychologists is a holistic approach. We understand the individual, we talk to them, we listen, we hear what you're saying, and we develop individualized treatments to provide you the intervention and support that you require to make the changes that you want. And that's one of the benefits of coming into treatment, is that we listen and we help you change. When people are struggling with mental health or dependency issues, sometimes the condition itself can be quite overwhelming. And even though there is advice from friends, families, it can be very difficult to make that initial approach to enter treatment. During this difficult period, it's important to consider about the life that you've experienced and the difficulties that you've been through. And the very contemplation of entering treatment indicates there's an unsatisfaction with life as it is at the moment. So one of the important things to do is to start to imagine the life that you want, where you want to go in the future, how you want that life to be. Start to think about what would you like your mental health to be in 6 months' time, 3 months' time, 5 years' time. What relationship do you want with yourself in the same period? Think about the relationship that you want with other people in your life. How would you like that to be in 3 years' time? Think about the personal pursuits that you have in life, your hobbies. Where have you been with those? Where do you want to go with those? Think about your physical health as well. How's your life thus far affected your physical health, your well-being? Think about your life thus far in many areas of yourself and your personality and the life that you lead, whether it's social or occupational. And think about how coming into treatment can be that first step to allow you to start to live the life that you want to live, so you can be true to yourself. Live the life you want to live will allow you to gain enjoyment and pleasure in life again. By coming into treatment, we'll be able to help you plan your life outside of treatment. We're going to give you hope to be the people who you would like to be, whatever that is. There's no judgments, but there is support, and we do listen. So when you're thinking about whether to come into treatment, think about the person who you would like to be and where you'd like to go. And begin by thinking about the possibilities that you can have by improving your mental health and not relying upon dependencies that have been unhelpful so far. Very lucky to be living in Thailand at the moment, and Thailand provides me an opportunity outside of work to do wonderful things and see some incredible places. I love the mountains, I love the beaches around Thailand, and particularly on my weekends I'm very active and I like to go for bike rides and explore the culture around here. But a big core to who I am is boxing, and I'm a huge boxing fanatic. And if I'm not out in the countryside or enjoying wonderful dinners with my girlfriend, you can see me watching old clips of boxing matches or reading about boxing, or then also participating in boxing still. So I'm still quite active in my sport and exercise. That's a big core to my personal pursuits and hobbies in life. And I also, it's going to sound maybe a little bit boring for some people, but I do love reading about psychology. So I do pretty much every day read a chapter from a psychological book and learn about the greats of psychology, because they've done all the hard work for us, so I can actually learn from that. And a lot of my approaches again will be based upon what I've read from some of the greats. And I love Thai food, so I'm always looking for a new Thai restaurant. So I love eating, I love spending time with my girlfriend, and I love sports.